Welcome to SC&M Laboratories Lab Post videos. In this video, we're going to discuss the certifications required for running a laboratory, the different levels of complexity of testing as defined by CLIA, and the testing offered at SC&M Lab. Any facility that performs direct testing on human specimen and uses the results from that testing for diagnosis, treatment, or assessment of health is required to meet specific federal guidelines. These guidelines are defined by CLIA, which stands for Clinical Laboratory Improvement Amendments. Any and all laboratory testing is regulated by these standards, regardless of the complexity of the testing. Even something as rudimentary as using pH strips to test for salivary or vaginal pH is considered a test. What doesn't fall under the guidelines set forth by CLIA are the collection and processing of human samples. So, if a doctor's office wants to hire a phlebotomist to collect and centrifuge blood, and then send that specimen to other reference laboratories for testing, the office will not need to be CLIA certified. The only human testing absolved from CLIA's standards relate to clinical trials and scientific research. If a laboratory or doctor's office falls under these guidelines, the facility must be certified by CLIA. Certifications are effective for 2 years at a time. There are 3 levels of certification depending on the type of testing performed and the personnel performing the testing. The lowest level of certification is called a certificate of waiver. This allows for a facility to perform what are called wave tests. The next level of certification is a certificate for provider-performed microscopy. This allows for certain higher complexity testing to be performed, specifically certain microscopy procedures that a certificate of waiver would not allow for. This mid-level testing under this certification does require that the test is performed by a physician, mid-level practitioner, or dentist. In other words, the testing cannot be delegated to a trained employee or technician, hence the name provider performed. In addition, the testing is limited to certain microscopic procedures, including urinalysis, KOH preps from skin scrapings, vaginal wet preps, pinworm preps, right stain microscopy for stool leukocytes and nasal smears, and fern testing. The next level of certification is a certificate of compliance. This allows for a facility to perform both waved and non-waved testing, depending on the level of complexity granted by the certification. Beyond wave testing, procedures are lumped into 2 levels of complexity, moderate and high. Moderate complexity testing would allow for any of the procedures discussed under the PPM certification and would also allow for a multitude of other tests, such as antigen testing, certain ELISA tests, CBCs, etc. High complexity testing expands the scope further, but has stricter criteria for certification. SC&M has a certificate of compliance and performs both waved and moderate complexity testing. Laboratories that are certified for moderate or high complexity testing are also signed up with a third-party accrediting agency. These agencies serve many functions, including offering educational materials, continuing education, and updates for changes in CLIA's requirements. Their largest purpose, however, is to conduct inspections of the laboratory in order to determine that the laboratory is compliant with CLIA's standards. In addition, they file renewal requests for the laboratory with CLIA. Laboratories that perform only wave testing do not need to sign up for an accrediting agency. These facilities will be inspected by the state, and renewal filing will be processed at that level. These different accrediting agencies serve different types of laboratory setups, and it will be up to the facility to determine which agency fits the practice best. SDNM is accredited through COLA. By far, the most common certificate issued is the Certificate of Waiver. Many of the tests desired for point-of-care testing fall under the blanket of waived tests. This, along with the more lenient certification requirements, is usually the best fit for many practices. CLIA defines a waived test as a simple laboratory examination or procedure that has an insignificant risk of erroneous results. Test manufacturers have their kits and products vetted by the FDA, who in turn determines the complexity of the testing. There are an abundant amount of waived tests available. A full list of tests is available on the FDA's website. When initially setting up a laboratory, a facility will need to complete the CLIA application form CMS 116. This form will also need to be completed if there are any major changes to the way the laboratory will function, such as changing an address, change in certification, etc. The form will need to be sent to the local state agency and can be downloaded from the CMS website. The tests offered at SCNM are listed here for reference. These tests have been selected because of their usefulness for the immediate results for their providers, as well as with respect for the cost of the test. Glucose, hemoglobin, and hemoglobin A1C are blood tests and can be tested from either fingerstick or venous blood. Rapid strep is tested from a throat swab and tests for group A strep. Influenza rapid antigen is tested from a nasopharyngeal swab and tests for both influenza A or B. Pregnancy is tested through urine only at this time. Occult blood testing is performed from stool samples and detects blood in the stool. It is an immunochemical procedure which looks for a protein specific to human blood. Urinalysis is performed by a dipstick and analyzer and checks for a multitude of parameters, including pH, specific gravity, glucose and ketones, bilirubin and urobilinogen, blood, and leukocytes. Moderate complexity procedures done at SCNM include urine, skin, and vaginal samples.